A recent survey says half of BC's rheumatologists are set to retire in about 10 years. Dr. Jason Kerr is not one of them, but he is worried about a possible shortage of physicians who specialize in helping people who have painful disorders affecting joints, muscles, connective and soft tissues, disorders like arthritis, gout, lupus, to name a few. Dr. Kerr is a clinical assistant professor at UBC in the Rheumatology Division. He is the president of the BC Society of Rheumatologists, and it is my pleasure to welcome Dr. Jason Kerr to Studio 4 to tell us more.
Great. Thanks for having me.
Nice to meet you. When you study rheumatology, do you start in internal medicine and go into subspecialties, or what's the drill?
Absolutely. Rheumatology is a subspecialty of internal medicine, so just like a lot of other branches like cardiology and oncology, you become an internist first, which takes 3 years of residency, and then you do a subspecialty for 2 years to become a rheumatologist.
Okay, so it takes how long?
Well, 13 years post-secondary total, so it's 4 years of a degree, 4 years of medical school, then 3 years of internal medicine residency where you're in the hospital, and then 2 years of rheumatology fellowship. So it's a long haul.
It is a long haul.
Yeah.
Do you think that's why more young doctors aren't specializing in rheumatology, or what's happening?
There's a lot of reasons why.
Sure.
There are so many great fields in medicine to choose from, and we have access to so many interesting fields that I think it's hard making a career decision. There's a lot of great things about other fields in medicine, and we really need to sell our professions so that we can attract the youth into them. And part of the problem that we've faced is we haven't done a very good job of selling rheumatology to some of the younger students and residents to get them interested in the field.
See, I think it'd be a good field because there's not a lot of blood and...
I think it's the best. So we have,
you know what I mean?
We have some of the most fascinating diseases in all of medicine. We have a patient population that is often young people in the prime of their lives that are raising families or working, and we have great new treatments that we can offer people that didn't exist 20 years ago, because rheumatology is a very young field. The first, rheumatologic diseases go back, centuries, but they were kind of first recognized in the 1920s. And then as a society, as a group, as a specialty, it's only really been since the early 80s that it's been its own dedicated field. So it's not something that goes back a long time historically. So we have a lot of work to do to try and kind of advance it forward.
Who sees a rheumatologist, for instance?
Yeah, our patient population is quite mixed, but for the most part, we see patients with rheumatoid arthritis, patients that have arthritis related to psoriasis. So if you have psoriasis, some people with psoriasis get joint disease. That's just like you can get inflammation on the skin, you can get inflammation inside their joints. We see patients...
So stop at the rheumatoid. The rheumatoid is arthritis that you inherit? It's
an autoimmune disease. It affects younger people, and the concept is that in the right person, so someone who has the right genetic mix, something in the environment triggers their immune system to go a little haywire, and then they start attacking their own joints with their immune system.
That's what autoimmune means?
Exactly.
Your immune system
rebels. Exactly, rebels against what it's normally supposed to do. And in the settings of rheumatoid arthritis, that attacks often the joints. It can involve other organs, though. People with rheumatoid arthritis can get eye involvement. They can go blind from inflammatory eye disease, and so our diseases are systemic, which is why you have to be an internist first, because there are other complications of the conditions that we see.
Okay, but the inflammation comes from...
It's self-driven. It's self-driven. So there's something that's triggered the immune system to kind of be wired incorrectly, and it sets off this cascade of events where the inflammation just goes out of whack. And it's like a house on fire. It's like your joints are on fire from the inflammation.
Very painful.
Very painful.
Has to be.
Yeah.
When does it begin, generally?
Well, rheumatoid arthritis is about 1 in 100 in the population, so it's not uncommon. And it typically affects women, and women between the ages of 30 and 60. So we're very much dealing with a segment of the population that, again, these are moms, these are career women, these are people in the prime of their lives that all of a sudden get a very debilitating condition that affects their mobility and their ability to, function essentially.
To lift a heavy pot.
Yeah, exactly. To work in the kitchen, to do anything around the house, to play sports, all of those things get affected.
Autoimmune goes on from rheumatoid arthritis to other diseases, correct?
Yeah.
Are all rheumatological diseases autoimmune?
Well, we kind of lump them together as being autoimmune. And, you know, our knowledge of the immune system is growing so immensely over the past 20, 30 years. And we're getting closer at pinpointing where some of the problems are with the immune system and why these diseases occur. And that's why some of the therapies are now targeted at specific steps in inflammation.
Okay.
I think we're still at the tip of the iceberg, though. I bet in another 10, 20 years, our treatments and the things that we're offering for these conditions are going to be so much more advanced. But it's really been an explosion of knowledge in rheumatology and also in the therapeutic options for people with these conditions.
Something like gout.
Yeah.
That's autoimmune, or that's inflammation?
Gout falls
that's too much red wine.
Yeah, it's all of the above, actually.
Okay.
Gout falls into our category of conditions that we treat, and gout is related to having too much uric acid in your bloodstream. And these little crystals of uric acid can precipitate in the joints and cause an inflamed joint.
Which apparently really hurts. I've never
had
had gout,
painful.
But I have friends
we don't
had gout.
We don't conceptually think of it as an autoimmune disease, but it is an inflammatory arthritis. You know, and that's part of the job that we do. There are 120 different types of arthritis, and if you get referred to a rheumatologist, our job is to try and sort out what type of arthritis do you have and what can we do about it? Because some of them have great treatments. Some of them, there are things that we don't have great treatments for yet, but there are a lot that we can intervene.
Treatments like?
So some can be as simple as physical therapies, that if you have an arthritis that you need to see a physiotherapist for or work on rehabilitation. But in the setting of rheumatoid arthritis, we have medicines that modulate the immune system that help turn off inflammation. And they work very well at preventing the damage that occurs to joints over time. And we recognize now that if we treat people early, if you catch someone with rheumatoid arthritis within the first 6 months and treat them as quickly as you possibly can, then the chance of them having irreversible damage down the road in 5 or 10 years drops immensely. So we are a lot more aggressive in trying to identify patients that have early arthritis and get them seen by the right physician so that they can get on treatment.
You said more females have arthritis than males. Is that linked to hormones, do you think?
Well,
or different hormones?
You know, autoimmune diseases in general are more common in women.
Stress?
It has something to do with genetics, and it probably has something more to do with having two X chromosomes. But you know, every autoimmune disease has a different pattern, and it seems that most of them are in women, but we do have some that are more common in men. There's an inflammatory back disease called ankylosing spondylitis, where you actually get total fusion of your spine, where the bone just grows over in your back, and that it's a really wild condition to see.
I'm sure.
And that
How do you know what's happening?
Yeah, you don't.
Question.
You know, people take up to 10 years to get diagnosed with this condition. And, but that occurs more commonly in men, and it occurs in very young men, often starting in their 20s. So again, it depends the condition, and a lot of it probably has to do with certain genetics.
Okay, but a lot of mystery around it sounds like.
Yeah, absolutely.
It's genetic, perhaps not. Is it related to jumping too much or physical abuse of the body, anything like that?
For wear and tear arthritis, absolutely. Things like osteoarthritis can be made worse by certain occupations and activities. Our concept of autoimmune disease is such that we think that you have to have the right genetics. There has to be something about you that predisposes you to these conditions. But then there's something in the environment, and we haven't identified it yet, whether that's a virus, whether that's some sort of environmental exposure, that when the two combine in the right person, they cause the immune system to just explode and do things that it shouldn't be doing.
Okay. We'll take a break and come back and talk more about aches, pains, and all this happy stuff.
Exactly.
Okay.